Explain procedure to patient. Place patient in a comfortable position that provides easy access to the peritoneal catheter and titanium connector. Ensure catheter is securely anchored with micropore tape. Clamp peritoneal catheter using peritoneal catheter clamp. Place blue underpad under catheter to protect patient from privadine iodine spills. Tape the underpad to the abdomen to secure as required. Clean work surface with surface cleaner. Open one pack of gauze on 3 sides of the pack. With gauze still in pack, soak the gauze with privadine iodine solution and place the titanium connector and transfer set across the soaked gauze. Wrap the soaked gauze and the outer packaging around the titanium connector and transfer set. Leave for 3 minutes. Wash hands. Open the outer packaging of the dressing pack and tip the dressing pack onto the clean work surface. Apply alcohol rub to hands, rub until dry. Open the dressing pack and aseptically place the following equipment onto it: transfer set, mini cap, privadine iodine solution, packet of sterile gauze squares ×3. Place open sterile gloves packet on a clean surface area. Perform 1 minute aseptic hand wash and put on sterile gloves. Arrange equipment on sterile field. Close the twist clamp on the transfer set and attach mini cap. Unfold and refold sterile paper towel and place back on the sterile field. Separate the individual pieces of gauze and place in a pile on the sterile field. Using a sterile piece of gauze, lift the peritoneal catheter by the cap on the end and hold it above the blue underpad. Using one of the sterile forceps, remove the privadine iodine soaked gauze from around the catheter and discard the gauze and forceps. Keep holding the line above the blue underpad. Place the open sterile paper towel on top of the blue underpad. Place 2 squares of sterile gauze on the sterile paper towel. Place the peritoneal catheter on the sterile field so that the titanium connector is sitting on the 2 sterile gauze. Discard the gauze that was holding the line. Soak 2 sterile gauze squares in the privadine iodine solution. Squeeze excess solution gently from the gauze. Leave on sterile dressing tray area within reach. Hold 1 piece of privadine iodine soaked gauze in your non-dominant hand in such a way that your gloves are protected from the non-sterile catheter. With a second piece of gauze in your other hand, lift the peritoneal catheter by the cap on the end and wrap the privadine iodine soaked gauze around the titanium connector. Discard the gauze holding the cap and pick up the second piece of privadine iodine soaked gauze and wrap it around the titanium connector. Hold the gauze squares in such a way that your gloves are protected from the non-sterile catheter. Scrub the titanium connector and groove at connection for 3 minutes. Continue to hold the catheter in one hand with a piece of gauze and discard the other gauze square. Using the remaining sterile forceps, pick up 2 large pieces of sterile gauze and place on top of the existing gauze on the sterile paper towel. Take hold of the catheter with the sterile forceps and place titanium connector on the sterile field. Discard the forceps and privadine iodine soaked gauze. Dry gloves on sterile gauze and discard. 2 sterile gauze squares are now required to change the line. Wrap 1 gauze square around the titanium connector, not the locking nut, and 1 gauze square around the transfer set. Ensure you have a gap at the connection to visualize the disconnection. Instruct the patient to remain still, to take a breath and hold it. Using the sterile gauze squares, unscrew the transfer set and discard. With a smooth movement, pick up the new transfer set. Remove the plastic cover on the transfer set using your little finger of the opposite hand, and connect the new line to the titanium connector, making sure the set is screwed on firmly. Perform exit site examination and care. Check catheter is immobilized correctly. Remove catheter clamp.